Now we are seeing 12 and 13-year-old kids with type 2 diabetes, and our country is in real trouble because the productive age group, if that is not well, how do you expect to progress?
What are the biggest food mistakes you've seen people make before and after diabetes?
The data from Indian population is that ragi and wheat, they raise sugar by the same margin.
Even things like belly fat, which otherwise a person is quite lean, but there is a lot of abdominal fat. Does that raise an alarm bell?
Belly fat doesn't mean diabetes, but it certainly is a warning sign for diabetes. Basically, hypertension, bad lipids, dyslipidemia, and diabetes, they are siblings. And obesity is the mother of all the three.
If someone has diabetes and now they're trying to control it with medicines and with lifestyle changes, what tests should they undergo and at what frequency to ensure their organs are safe?
HbA1c, it's a 3-month average, so obviously once 3 months.
Right.
Lipids once in 6 months, and the rest of the organs to be screened every year. Pre-diabetes and diabetes, they carry a similar risk for heart problem and stroke.
If someone has diabetes, can they still drink alcohol and in what capacity? Hello everyone, very warm welcome to the 18th episode of Conversations with Zyla. I'm Khushbu Agarwal, founder at Zyla Health, and I'm pleased to welcome you today to this very special edition of World Diabetes Day, titled Sugar Rush Preventing Diabetes in the Young. It's indeed my pleasure to welcome our special guest for this podcast, Dr. Dheeraj Kapoor. He is the Chief of Endocrinology at Artemis Hospital's Gurugram, and comes with 3 decades of rich experience in treating endocrinology-related disorders and metabolic disorders. Thank you so much, sir, for joining us today.
Pleasure is mine. Yeah.
Dr. Kapoor brings deep expertise in this field. He has earned his MBBS from Jivaji University, Gwalior in 1995, followed by his MD and then DM in endocrinology from the Institute of Medical Science, BHU, in 2005. We are indeed privileged to have you today with us, and our audience can't wait to uncover everything about diabetes with you, Dr. Kapoor.
Fair enough.
Great. So, Dr. Kapoor, to start with this conversation today, we have, asked our users and audience a lot about what worries and troubles them about diabetes. And the number one thing is the symptoms that come with it. So we want to first cover these red flags which young people are facing today, and it is not just the old, and help demystify for our audience what it really means if they have these symptoms.
First of all, diabetes, we've been taught causes polyuria, which is more of urine, polydipsia, excessive thirst, and of course, weight loss. But believe you me, 60% people with diabetes do not have these symptoms. In this era where we are checking sugars for the corporate checks and the likes, so many people come to us with HbA1c, which is the 3 months average, or the sugar levels in range of diabetes without any symptoms.
Wow.
Now, that is the alarming part. You have diabetes, it is causing organ damage by the day, and you aren't aware of it. The other problem is that you get your sugars checked and someone says this is pre-diabetes, and then you say, oh, it's just pre-diabetes, let me relax. And then, of course, your diet, exercise are unaltered and you end up. So the best part is that you need to check your sugars periodically, every year at least, if you don't have diabetes. I'm being totally practical here. Leave aside the textbook. The reason is that most textbooks are Western textbooks, right? And they are different from us gene-wise, physique-wise. So let's have our own way of doing things. And past 35, some people say past 45, numbers don't matter, but have your sugars checked at least annually to be doubly sure where you are.
Great. And do you see...
So no symptoms don't mean no diabetes.
Okay. So even things like belly fat, which otherwise a person is quite lean, but there is a lot of abdominal fat. subcutaneous fat. Does that raise an alarm bell?
So, first of all, subcutaneous fat all over the body and the belly fat, they are two different things, right?
Right.
Belly fat is the bad fat, B for belly, B for bad. We Indians, for the same body mass index, have a higher belly fat as compared to Westerners. And that is why the guidelines for overweight and obesity are different in Southeast Asians as compared to the Westerners. Whereas belly fat doesn't mean diabetes, but it certainly is a warning sign for diabetes. There's none denying the fact. And of course, I've talked about the sign. So, blackening of skin of the neck
Right.
and tags there, they are also a sign of impending diabetes. Theoretically, it is insulin resistance, but otherwise, for the layman and the likes, it is actually a sign for impending diabetes.
Right. Dr. Kapoor, you mentioned insulin resistance, which is quite a complicated concept for the layman. Can you explain to our audience what it means?
So, I will tell you how insulin resistance causes diabetes. What happens is that when you have belly fat, it produces some chemicals called interleukins and others, resistance vascular knowledge. They actually impair insulin action. So the pancreas, in a bid to digest the sugars, they produce more insulin.
Right.
So impairing action means resistance, and to overcome that, the pancreas secretes more insulin, which means that it's being flogged at it, as it were. So once you flog a bullock repeatedly, it'll run fast, no doubt, but at time it sits down.
Right.
I can't do this further. So that's the time when your pancreas are flogged enough, the beta cells, the insulin producing factory, shuts down, or very little effort. Once more than 50% of pancreas are gone, you get diabetes. So insulin resistance means, look here, insulin is not acting, please lose your belly fat. Let pancreas relax, let them function properly, and delay or even prevent diabetes.
Got it. And is it true that if someone has insulin resistance, it just doesn't cause diabetes, but a myriad of other diseases?
Okay, so it does. So making it interesting, basically hypertension, bad lipids, dyslipidemia, and diabetes, they are siblings.
Right.
Someone may be an older sibling, someone a younger sibling, and obesity is the mother of all the three. Mind you, obesity is linked to 128 diseases, and obesity itself is a disease. And what happens is that we people, and please don't mind my saying that, we people don't behave ourselves, and once someone calls us obese, we feel hurt. Now, they are not saying obesity anymore, they are saying adiposity. And obesity is ABCD, adiposity, born chronic disease.
Correct.
So, yes, and it is a harbinger of many, many things, right from a premature cardiac death to osteoarthritis to depression. So, obesity can cause everything under the sun that you think of.
And 128 diseases you're mentioning.
Yes.
And so just losing weight or preventing being overweight or obesity can be the first step to preventing any chronic condition.
I'll tell you something. So of course the Shada has just gone. So on that note, so Bhagwan Sri Ram used to sever one end of Ravan, and then they used to spring up, right?
Right.
So you address hypertension, diabetes springs up, whatever. So what he did was he hit it in the Nabhi, the navel. The Amrit was busted and Ravan died. So address the obesity, lose weight, and you address arthritis, depression, hypertension, diabetes, all of that.
So knocking off one head at a time doesn't help. You have to basically shoot on the root cause. Very, very fair. Dr. Kapoor, thank you so much for sharing that. And closing on to the symptoms bit, we hear of some people talking about tingling, numbness in their feet.
Yes.
Is that also something you've heard of?
So basically that is symptom of neuropathy, which means the diabetes involving the nerves. The nerves have a few way of getting angry at you. Number one is tingling, burning, then lancinating pain, And if someone is really, really angry, they'll stop talking to you, which means that the foot loses its sensation.
Right.
And the nerves are so much angry, they wouldn't wish to talk again. So sometimes that symptom doesn't reverse. And that is the time when you have a pinprick, you can't figure out your slipper. That's very late. But this tingling burning you're talking about are the initial stages of neuropathy, the nerve involvement because of diabetes.
Right. And because you spoke about these pin pricking sensations,
Yes.
Dr. Kapoor, in our work at Zyla, we've also seen that there are some coupled symptoms, right? So, for example, a person has this symptom, they also have vitamin B12 deficiency along with uncontrolled diabetes.
Okay.
So, can you help our audience understand that?
So first of all, any and everyone who is a vegetarian person, you must be beware of vitamin B12. I'm not saying that you become a non-veg. No, I'm not saying that. But what I'm saying is that if you have a deficiency, take a supplement. The other issue is that metformin, a wonderful drug for diabetes, that also causes vitamin B12 deficiency.
Right.
So if someone has burning and tingling, of course neuropathy, but vitamin B deficiency should also be looked into so that we are better off and address the issue there and then.
So you've seen both happening together as well. And the last one, Dr. Kapoor, which is on really mood swings or feeling very stressed very often. Have you seen that being linked to diabetes symptoms at all?
Well, I think it's a bidirectional affair. And believe you me that what happened was earlier, the people used to say, ये बच्चा मोहल्ले का है.
Right.
Then we came, ये बच्चा हमारे घर का है. Then we say, ये बच्चा मेरा है. So we've come down from a society to a joint family to a nuclear family.
Absolutely.
Mind you, the society and social gatherings, they were a very big stress buster. You used to share your sorrows and laughter, and it also used to double up. Now, here what is happening is that first of all, nuclear family, stress on a job, lack of sleep, targets to meet and all of that, they are causing stress. Stress causes certain hormones called catecholamines and cortisol to rise, and they cause insulin resistance, which you were talking about.
Got it.
So any and everything which worsens the resistance will actually either cause diabetes or worsen the sugar control.
Got it. And Dr. Kapoor, I know we were talking about early diagnosis or new diagnosis, but have you seen cases where someone comes with an injury, like चोट लग गई और वो भर नहीं रही है कुछ समय तक, and that leads to discovery of diabetes?
Honestly, no, and I'll tell you why. Of course, we've all read it, but possibly I work in a tertiary care hospital, so those are not the kind of patients I receive.
Okay.
But yes, it is a well-described fact, and people in the periphery are still seeing those kinds because sugar monitoring in the tier 2 or tier 3 cities is not in vogue. I personally don't get them because I work in a tertiary hospital, but yes, this is a fairly common symptom down the line, maybe in smaller cities.
So what you're saying is everything from frequent thirst to frequent urination to tingling sensations or even stress or mood swings or belly fat could be a symptom or impending symptom. But sometimes people would walk without any symptoms.
Yes.
So it's very important that you test annually.
Yes.
Got it. Great. Thank you so much, Dr. Kapoor. That was really enlightening. Now, coming to the topic of diabetes in the young, because this is what we are facing today in India. While diabetes used to be a disease of the 50s and 60s, now, we work with a lot of corporates and we see employees who are just in their late 20s and 30s who are dealing with pre-diabetes or even HbA1cs of near 8, 9, right? So, what do you think is the reason? Why is this really happening?
See, I'll tell you something. Basically, diabetes of two kinds for the common parlance, type 1 and type 2. Type 1 happens in children, young children, maybe below 20. Maybe I'm saying I'll come to that later.
Right.
And type 2 in the older. When we were doing our DM and a child came with diabetes, even if we mentioned the word type 2 diabetes, the examiner would fail us.
Wow.
Now we are seeing 12 and 13-year-old kids with type 2 diabetes of the adults. So the diabetes in the young, type 1, happens because pancreas are destroyed by some mechanisms, the autoimmune ones. And type 2 happens because of your lifestyle habits. The junk food, and I'm not here to mention the name of those foods, lack of exercise, glued to the TV, So you are just eating and not burning calories, gaining belly fat. That is causing type 2 in children. You said late 20s, I am saying late teens. Type 2 diabetes.
That's devastating.
Devastating. Type 1 is obviously not a fault. Ignore that for the moment.
Genetic, autoimmune.
But type 2, it's sheer, stupidity on the part of the parents. So I was speaking at a national conference, ESICON in Kolkata, and someone said, what do we do? The child orders from Swiggy and from Zomato. I asked, who gives them the money? Who gave them the mobile? And you'll be interesting to know that children who watch TV, just the TV, get fatter as compared to those who work on the laptop. Why? Number one.
Advertisements.
Number two, their hands are free to eat.
Right.
Not free to eat. So that's a very common thing that those young kids know. Pokemon dekho, ye dekho, wo dekho, and they see that and they're nibbling.
Because the mind is not in the food. It's
Yes.
subconsciously eating.
No, and your hands are free, no?
Your hands are free.
So these things, but type 2. So children are getting type 2 and our country is in real trouble because the productive age group, if that is not well, how do you expect to progress?
And is this very India specific, Dr. Kapoor?
Specific to Southeast Asians, specific to countries who've not seen money, they are certain having a splurge of money.
Okay.
And there is a very famous American food chain. It's in every nook and corner. That is the food chain where the affluent Americans don't go.
Right.
And we go there for birthday parties.
I know what you're saying.
So that's the problem.
So is this more of an urban phenomena than rural then?
Somewhat. But rural have their own problems, like those thalas who sell noodles, those thalas that sell burgers, and those thalas that sell spring rolls.
But still, as you said, right, money is not in abundance. So it's not like you can eat a pizza every day.
You can't. You can't. But you don't need to eat a pizza every day. If you eat a pizza maybe twice a week, you are done.
Right.
Or rather undone, whatever.
So you're saying you're seeing diabetes in people with an age group of 12 and 13?
Not regularly, but very commonly below 20.
Very commonly below 20. And then they live with it forever, or are some of them able to reverse it, Dr. Kapoor?
So reversal and remission, they are two different things.
Right.
So someone has diabetes, we put them on medicine. What would reversal mean? Reversal means that the sugars are controlled. They are able to get off all the medicines and then they eat whatever they like. They are on the couch, which is never the case.
Right. It's never the, earlier days.
So reversal doesn't happen. Remission happens with lots of discipline. So you have your medicine, control the sugars, the levels come down, you stop the medicine, but continue exercise and restricted eating. Restriction doesn't mean low on chapatis or rice or potatoes.
The home food is not bad.
It means zero on the processed food, the sweets, the fried, the soft drinks, all of that.
We have a lot of young parents on the podcast, Dr. Kapoor. What advice would you give them given this fact that you just shared, which is alarming?
Lead them by example. If someone has diabetes in home and you have a whole mango in front of him or a whole cake in our language, barfi or jalebi, how do you expect the other fellow not to eat?
Right.
As it is, if someone is a big no, you feel like doing it.
Correct.
So in diabetes, as it is, before diabetes, they didn't like sweets. Now, since it has been said a big no, they like sweets.
Correct.
This is human nature. So I think the whole family has to cooperate, and that is not a sacrifice. It's just
It's a way of living.
It's a cooperation. Let's stop using those words of sacrifice करना, त्याग. कोई त्याग नहीं है. आप साथ वाले के लिए कर रहे हैं, उसने भी किया, आप भी करो ना.
And your family.
Yes.
Right. So I'm very, very unpleasantly surprised with the fact you shared, Dr. Kapoor, and deeply concerning and very important for parents to take the larger role and avoid, as you said, ghar ka khana is not really dangerous, but what is dangerous is the packaged food which comes in shiny packs.
I mean, why can't you have grilled chicken at home or chicken curry at home?
Correct. Just make it at home. Right. And have you seen a lot of patients come to you and say, "Sir, ये तो मेरी family में run होता है." Is this really true?
See, खुशबू मेरे मूड की बात है. So if I am not tired, I'll say, okay, doesn't matter, I'll settle it. But if I'm upset for any reason, I tell them, look here, gentlemen, the diabetes may or may not run in your family, but your physique tells me that no one runs in your family.
Yes. Correct.
Baba, you have a loaded gun, no? You have your genes which make you put on belly fat.
Correct.
You can't change your genes. So you have a loaded gun. Why would you want to fire it pointing at your own self?
So it may be related to genes that you're predisposed, but it is completely in your control. So now talking about genes, and you covered this, Dr. Kapoor, just now. Are we more predisposed to belly fat
Absolutely.
or high lipids, and why as Asians?
No. And so as why? There's something called a thrifty phenotype.
Okay.
We are different from the Caucasians. We know that. What happened was that the area of famished or the famine area, the body was made to store more fat for energy. And this is not a matter of 5 or 10, it's a matter of a million years since the prehistoric men. So now we have abundance, so the body is storing fat here.
Right.
This is called. So I was presenting a lecture on postprandial blood sugars, and there was this data that an American consuming 2 cookies vis-a-vis an Indian consuming 2 cookies, the sugar surge would be higher in an Indian as compared to an American.
Okay.
So it's not your fault. The genes are fine, but now that you have those genes,
We can't blame the genes. Right. Absolutely. And what about men versus women, Dr. Kapoor? What trends do you see in your practice? In the young, in slightly older?
no, obviously men outnumber women, but I'll tell you something interesting about women, that women as a sex or as a gender are less prone to cardiac problems as compared to men. But when they develop diabetes, they lose that advantage.
Okay.
Yes, in our society, in the tier 3, women are quite savvy and quite, educated. But in the tier 2 cities, the women tend to ignore their health.
Okay. So if we had to do a tier-wise mapping, you would say men would outnumber women in tier 1, and tier 2, tier 3, women will maybe start outpacing or will be more in number comparatively.
Once they wake up to the fact.
Okay.
As of now, obviously men. Because in the tier 2, tier 3, women actually ignore their own health for this bigger cause of the family.
And I think it's said that after menopause, it's even riskier if you
Yeah,
develop-
because that is the time you tend to put on the belly fat.
Right. And then estrogen is not there to protect your heart. Got it. So, Dr. Kapoor, now coming to, you're saying we are diagnosing diabetes in people under 20, over 20, men, women, urban, rural, it's across, right? And people are coming in without symptoms, correct? So, just to shed light on now how to diagnose this well and in time, what are your tips?
The gold standard is still a fasting plasma glucose, and then give the patient 75-gram glucose
Right.
and check sugars too after that. That is still the gold standard. The other could be HbA1c, which is the 3-month average. But still, of the two, the gold standard remains the glucose
And
tolerance
what does
test.
this 75-gram sugar in 2 hours after that, how does it help?
So I'll tell you. So fasting sugar less than 100 is normal, non-diabetic. 100 to 125 is pre-diabetes. But some people say that pre would mean that he has pre-diabetes, they'll surely have diabetes, which is not the case. So now they are using the term at risk for diabetes. And 126 or more is diabetes. But then you have to have 2 readings because it's a big diagnosis to make. And after glucose, so below 140 is non-diabetic, up till 199 is pre-diabetes, and 2 and more is diabetes. HbA1c up till 5.6 normal, 5.7 to 6.4 is pre-diabetes, and 6.5 or more is diabetes.
Right. So I see our audience has started putting in a lot of questions. I'll request my team to start addressing them. We will try to take a few towards the end as we get all the wisdom from Dr. Kapoor. So, Dr. Kapoor, now someone is diagnosed with, say, diabetes at a certain age. There are a lot of myths around when should I start medicine. If I start a medicine, it'll be for lifelong. If I start a medicine, it'll damage my kidneys. So, how safe are medicines and are they lifelong?
So, are they lifelong? So, what came first, the disease or the medicine?
The disease.
Absolutely. The second part is this is not an infection. I give you medicine for 5 days for malaria or 9 months for TB. It's gone. No, it's a lifestyle disease. And mind you, once you get diabetes, as I said, you have already lost your 50% of beta cell mass. How would that come back? Now, all medicines are compounds and they can have side effects. There's no doubt about it. But remember, it's a medicine, which means that the benefits far, far outweigh the side effects. That's why it's a medicine, no?
Right.
Let's reverse the things that hardly any benefits, more of side effects. It's a poison then. The other issue is that medicine may or may not have a side effect, but deranged sugars will certainly damage the organs. There are no two thoughts about it.
Got it.
So you have to have medicine. As regards kidneys, well, there is not a single medicine that I know of, diabetes, that damages the kidney. Now, why that question and why that myth? What happens is that the patient is taking tablets, sugars are not controlled, and he's being told repeatedly, look here, start insulin, start insulin, start insulin. And they say, no, give me a chance. So it is the high sugar which damages the kidney and the poor tablet is blamed for it.
Got it.
The other issue is that someone is on tablets and we are saying, please start insulin, and they take too long. And after 3 years of starting insulin, you develop a kidney failure.
And you put it on insulin.
And I will say that it happened because you started insulin in 3 years. Had you not started it, it would have happened 2 years earlier.
So very clear. You're saying there's no medicine that really damages the kidney. What happens is that delayed treatment or uncontrolled diabetes.
Uncontrolled sugars damage.
Yes, that damages it. So now coming to that topic of organ damage, which you emphasized few times, Dr. Kapoor, we know that diabetes damages the kidneys, the heart, damages the nerves, eyes, can lead to diabetic, foot problems. What tests if someone has just developed diabetes or pre-diabetes, right? And they have been asked by their doctor to start a medicine.
Let me tell you this, that pre-diabetes and diabetes, they carry a similar risk for heart problem
Okay.
and stroke.
So it's not like, oh, I'm pre-diabetic, let me think about it next year.
Yeah. And for diabetes, well, it is kidney, it is eyes, it is nerves, and now liver in a big way. Some enlightened people may say that even pre-diabetes causes nerve involvement. I will not go there. Yes, that's a contentious issue. Cases have been described. But for the common man, I think that pre-diabetes, neuropathy is very, very rare.
Got it. But it's more heart, kidney, eyes.
No, pre-diabetes is more heart and stroke.
Okay.
Possibly liver. Yeah.
And then diabetes, you're saying, impacts different organs. So if someone has diabetes and now they're trying to control it with medicines and with lifestyle changes, what tests should they undergo and at what frequency to ensure their organs are safe?
So frequency is individualized, but broadly speaking, HbA1c, it's a 3-month average. So obviously once in 3 months.
Right.
Lipids once in 6 months. And the rest of the organs to be screened every year, which means kidney function tests, liver function tests, then of course thyroid, then of course the urine test for how much protein is leaking,
Right.
ECG for the heart, echo for the heart, and fundoscopy for the eye. Fundoscopy no lab does.
Okay.
It's the eye specialist doctor, ophthalmologist who does that.
So you have to go to an eye clinic.
Yes.
Got it. And in terms of self-monitoring at home, Dr. Kapoor, we have seen people are, again, very careless about this, right? Doctors suggest that you should have a glucometer, you should measure sugar yourself, not just wait for an HbA1c every 3 months. So what is your advice on self-monitoring at home?
Suffice to say that all my prescriptions carry the writing SMBG, self-monitoring blood glucose. Every prescription of mine. And this is very, very important.
Got it. And for any of your patients, Dr. Kapoor, do you also prescribe any supplements, vitamin supplements, which help them just manage their disease better? Is that common?
Generally, vitamin B12 in those with symptoms, and of course on metformin and veg. Vitamin D I give invariably.
Okay, because we're all indoors and not going out to the sun. Got it. So vitamin D and vitamin B12 are things to be say tested or ask your doctor
Yeah,
about if
yeah.
you are under diabetes treatment. Great. Now we'll come to the elephant in the room, Dr. Kapoor, which everyone has the maximum questions on, and I'm sure our chat is flooded with it, which is food and diabetes, correct? Because we know people look for shortcuts and क्या बोलते हैं जादू वाली गोली, but we know it's all persistence and hard work. So just to address some of those questions, what are the biggest food mistakes you've seen people make before and after diabetes?
Well, there are certain instances, but I think stopping chapati and rice
Okay.
is a big blunder. See, not too much of, but at least 50% of calories should come from carbohydrates.
Got it.
40 to 50. Now, the Indian study, ICMR study, that showed that 64% of our calories come from carbs, which is wrong. But at least you should have chapati and rice. Everything in excess is bad. So I'll tell you something, that these people will stop chapati, they will stop rice, and then steal into a barfi. That is hilarious. As regards the millets, that's a very important question. So the data from Indian population is that ragi and wheat,
Right.
they raise sugar by the same margin.
Okay.
Jowar, bajra, jaw, and chana, of course, they raise the sugars lesser.
Got it.
You must also understand, I've seen so many people whose sugars remain normal with rice, but roti causes glycemic surge or high sugars. So that is totally individualized.
So, Dr. Kapoor, someone asks you that how should I make my chapati flour, which is a very common question we get, because they've seen too many videos on YouTube and suggestions that make multi-grain atta or only eat millets, as you said. So, is there a guidance that you give as a doctor?
Any chapati which is tasty and palatable for the longer term, you should do that. Yes, if you are, so the two sets, one is a gehu ki roti and one is a mixed grain roti. If you are okay with both, I'll say a mixed grain roti.
Got it.
But if you are not okay with mixed grain, have the gehu roti.
Par man se khai.
Paraman se khai.
Right. What about rice? Is there a champion between white rice and brown rice?
Obviously brown rice, but as again I said, that brown rice is not too much of palatable for most people. So you could have small
Correct.
amount of white
Sometimes.
rice.
Got it. And this whole range of healthy smoothies, healthy bars, healthy granulas, what's your take on that, Dr. Kapoor?
As long as they're healthy, which means that if they are healthy, they would have lots of nuts, minus the cashews and the resins. They would have possibly a little honey or dates rather than corn syrup, which is an absolute disaster, or those fructose things. So yes,
white sugar.
Yeah, no, white sugar, to khair, ideally they shouldn't be having. So we
Right.
won't tread on that path. But I think if lots of nuts and some honey as a sweetener, I think that should solve the purpose.
And you mentioned honey, which means it's safe in small amounts.
Small amounts.
Small amounts. What about jaggery and stevia?
So I will tell you. First, compare jaggery and sugar, because people say हम चीनी नहीं खाते, हम गुड़ लेते हैं और हमें इतनी सी गुड़ चाहिए खाने के पहले. See, so jaggery or gur has no chemicals. It is very high on iron. We know that.
Right.
So, from the general perspective, jaggery is better than sucrose because there's no sulfuric acid, there is no chloride in there. But from the sugar surge standpoint, both are equally bad.
Like we call it glycemic index.
Absolutely. So I didn't use that term because so sugar surge. So both are equally bad.
And this, whatever you're suggesting on the food, Dr. Kapoor, is relevant for anyone who's even preventing diabetes, right?
Absolutely.
It's not just about someone
No.
who has diabetes.
As regards stevia, yes. As we talk, it is the safest. Had you talked to me 10 years back, I would have said sucralose. So things are evolving by
Of
the
course,
day.
the sugar-free we used to get.
Now I'm saying, so now we are saying stevia.
Got it. And Dr. Kapoor, because again, it's a very confusing market. You can get a lot of things which call themselves healthy and look healthy on the packaging. What is your suggestion to our audience on what should they read in the label before selecting or rejecting any item?
The fat content, the carb content, the sugar, the
Added
sucrose,
sugar.
or glucose. And even if it's not added, don't get misled. For example, a juice, bold writing, no added sugar. अरे बाबा उसमें पहले ही इतना फ्रक्टोज है, तुम क्या ऐड करोगे उसमें?
And it's all in the, what do you say, easiest absorbable form.
Yes, because that has no fiber, so it is absorbed totally.
Immediately to the bloodstream.
Absolutely.
Got it. And now again, a very common question we get, Dr. Kapoor, is on these nutritional supplements, protein powders. So as you rightly said, right, people avoid chapati, rice, and then they jump into these things for their nutritional needs. So are they safe, not safe? How do you decide?
Well, this is a very debatable question, and it may actually raise a few eyebrows. But protein supplements, I'm not very clear about, because there are so many young kids who join the gymnasiums and they come back with low testosterone levels. I will not go there, because that will really spark controversy and debates. I will not go there. But yes, from a reputed this thing, if you need to supplement, particularly people who are on Ryle's tube feeding, who can't swallow,
Right.
in them, of course, protein supplements, powders will benefit.
But then the problem is it a good quality or not is really an eye wash.
Yes, that's why I said a reputed company. The other thing is that there are some supplements which actually have lots of fiber, and they fill your stomach so that you don't feel hungry. Those are actually beneficial. Those are actually so, because they give less calories, more of fiber, so your stomach is full a long time. You eat less, and therefore the sugars don't rise.
Got it. Okay, so that was very insightful, Dr. Kapoor. Now, when we talk to our patients, even at Zyla, the most common question we get on preventing or managing diabetes is these home remedies in India, which I wanted to uncover with you. I know you are a doctor of allopathy and you follow science and FDA approvals, but just because these are very common questions, there's some home remedies used in India such as methi, Karela juice. What is your input on that to your patients?
First of all, we've not studied in our curriculum, but I'll tell you something, that there are people whose sugars are not controlled, and then they come and tell us that we started this, jamun powder being common, methi being common, and Karela being common.
Right.
And our sugars got controlled so much so that we are having low sugars. Now, the first thing I do is that I get their serum cortisol levels and kidney function tests, liver function tests, and they are normal. So I can't say that, but this is what people tell me. So I'm not disputing that. I'm not favoring that, but I'm actually putting forth the patient's views that they give us. So I'm not saying that methi or Karela will cure the sugars. I don't think they will. But then we have to respect the patient's statements. And why would they lie to me, actually?
Right. But we've also seen cases, Dr. Kapoor, of course, if these are naturally created, boiled and cleaned and had at home separate, and you can supplement it with your regular medicines. But we've seen cases where people are using bottled juices, which again, we've seen cases of liver damage because of those. Have you seen something like that?
Liver damage and stomach ulcers which bleed.
Right.
What happens is that diabetes, the commonest cause of death is a cardiac issue. So most people are on blood thinners, aspirin.
Right.
So if you're on aspirin and you have an ulcer in the stomach that bleeds, you've had it.
You'll have excessive internal bleeding.
Of course. So this is not a generalization, but yes, I have seen people with that.
Got it. So, the natural forms of these in small amounts and naturally created at home may be still fine to supplement. In some patients, you have seen that.
I'm not saying that. See, for example, things that are coming from outside the other companies, we believe that they'll be fair and they'll be pure. So in that case, those purchased from outside or the homemade would have the same risk factors. No.
Got it. Okay. And have you, again, seen cinnamon have any impact, positive or negative?
This is very interesting. So, cinnamon powder has been shown to have impact, but if you take the cinnamon stick and chew it, not as beneficial.
Okay, got it.
But I can't explain that.
Yes, of course. We just want to understand what you've seen in your 3 decades of practice. And what about Giloy, Dr. Kapoor?
People say giloy, then paneer ke phool. They do say that. Yes.
Okay. So you've seen patients have some benefits, but again, has to be very cautiously.
As the patients say.
Yes.
Yeah.
Got it. Okay. So, Dr. Kapoor, one thing we have seen again in people who have pre-diabetes or diabetes is they mention certain trigger points of what raises their sugars. Correct? So, I wanted to cover some of those and get your guidance whether this really triggers sugars and how to manage, right? So, things like stress, does it really spike sugar temporarily?
So, what is stress? Stress actually causes the cortisol surge, the catecholamine surge, which I said at the start,
Right.
worsens insulin resistance. So, cortisol is at the lowest at 11 p.m. Because you are supposed to sleep at that time. Your ancestors did, right? So, and this is a million years I'm talking about, not those 10 years. So, what happens is that once you don't sleep, the cortisol levels don't go down. That is why lack of sleep, and this is very clear that you sleep well at night, check your fasting sugars, and you don't sleep well, check your fasting, they'll be slightly higher. मतलब ये नहीं कि 99 के बस हो जाए, but it'll be 104, 106 as compared to 95.
Got it. Got it. And what about excessive caffeine, tea, coffee?
So, okay, this is interesting. So, there was something called a Hoon study from the Netherlands that showed that this big mug of coffee, 5 of them black coffee, actually reduced the risk for diabetes.
Okay.
But the way we drink it, lots of milk, sugars, it won't help matters. And of course, if you drink it at night and don't sleep, then the lack of sleep causes its own set of problems rather than the tea or coffee per se.
Got it. And Dr. Kapoor, some medicines like steroids, do they cause
Of
temporary
course, of
spikes?
course. Of course, steroids cause lots of problems, right? From poor sugar control to poor lipids to poor blood pressure, all of that. Yes, steroids do cause it for a variety of reasons, but obviously it's more of physiology and biochemistry. So let's jump the queue. But yes, steroids worsen your sugar control.
And you mentioned even lack of sleep causes this.
Again, because
Linked
cortisol
to
surge.
the cortisol. Got it.
So, cortisol is a steroid basically.
Okay. Right.
Yeah.
So it's a natural occurring in the body. And now, covering another big sort of question we get from our users is on certain fad diets or popular diets, I may call them, such as intermittent diets and keto diets, right? So people resort to certain short-term interventions to try and control, reverse, or whatever words they use. Do these work, Dr. Kapoor?
So intermittent fasting can be either 16-8 or 5-2 that 5 hours fasting, 2 hours eat. And
Eating
then,
is.
so our ancestors were doing that all the time. Early to bed, early to rise. So slept at 8, right? And then of course woke up at 4 in the morning, went for the morning walk. Mind you, no jogging, no treadmills, no gymnasiums. Tehelna, moderate walk. Came back at 6 and then whatever, and breakfast at 7 o'clock. Without doing any intermittent fasting, they were fasting for 11 hours.
Okay. So that's more of self-discipline and sleep cycle management than
Yes,
just...
but on a more serious note, yes, intermittent fasting reduces insulin resistance, reduces your weight. It is all known. But you must understand that a class of medicines called sulfonylureas, if you're on those drugs, you shouldn't fast for too long because you may have hypoglycemia or low sugars. Also in type 1 diabetes, that are the children, you shouldn't be fasting for too long.
Got it. So again, under close guidance of your doctor,
Yes.
obviously. And what about keto diet? Dr.
Keto diet, so that means high on fat.
Right.
Right? So yes, that is known to cause weight loss. that is known to cause insulin resistance, but sometimes high fat may cause a high cholesterol, and that can be bad for the heart.
Got it.
And obviously high keto diet would obviously bad for type 1, because type 1 diabetic patients have somewhat diabetic ketoacidosis.
Correct.
So keto diet might not be a very smart option for them.
Got it. So intermittent fasting is a natural phenomena for the
Phenomena
human
for
being, but
human-
keto may be a little bit more
More
artificially
this thing.
driven.
Yes, and if you take if you do that under supervision, I think it's a decent thing to do.
Got it. Got it. Coming on to the other questions, Dr. Kapoor, on the common siblings you mentioned of diabetes, BP, cholesterol. If someone has multiple of these conditions, a lot of people live with diabetes, BP, and cholesterol. So, what is your guidance on how they control these diseases or prevent complications?
So first of all, let me answer the first question, that keto diet, it's a big if, and the if is supervision. Right?
Right.
Now coming to this question. No, as I said, healthy lifestyle addresses all the three. For example, in high triglycerides, you aren't supposed to eat too much of sugar. That holds true for diabetes also. In high LDL cholesterol, you aren't supposed to eat too much of fat. That holds true for dyslipidemia, blood pressure, and diabetes also. Then exercise. If you exercise, then you burn your sugars. You have a healthy lifestyle, the BP goes down. You burn your cholesterol. So if sibling is there, then obviously one thing, a disciplined life will address all the three.
Got it.
And disciplined life is MNT, medical nutrition therapy. And of course, lifestyle changes, which includes MNT and exercise.
Yes, so just coming to that now, Dr. Kapoor, would love to double click on that. Of course, we discussed the do's and don'ts, but what is, if you have to give guidance to your patients, you had some tips on how to exercise and how not to. If you can double click on that, and also the diet tips.
So about exercise, see, if you can gym or cycle or swim, very, very good. But cardio is also beneficial in its own right. So cardio, if you don't walk, I'll ask you to run for 1 hour today. You'll feel breathless, your limbs will ache, and you won't walk for the next 5 days. So the crux is always start low and go slow and escalate by the day. The Western guidelines say 150 minutes of exercise per week.
We need to do more, right?
Yeah, but in Indians, 300 minutes. 300. About diet, well, no to sugars, simple sugars, not no to carbs. No to simple sugars, no to juices, neither the homemade nor the ones, and the fried food. No to all that. When I say no to all that, well, once in maybe 2 weeks you could indulge, but not because I have allowed it, but because of your conscience. That this far and no further.
Yeah. What I've also seen, Dr. Kapoor, is if you're having a puri made at home once in 2 weeks, that's still okay because you'll not reuse that oil.
Absolutely.
And your things are hygienic and clean and all of that, right? But not making it at home and then indulging it in a restaurant is, I think, more dangerous.
I would put it in this way, that eating puris at home is bad, and having outside is still worse.
Yes.
I mean, on the pretext that this is a fresh oil, my mom is making it, purity, you still should not go overboard.
Yes. I mean, I'm saying once a month.
Absolutely.
If you do cheat, that's better than going to a restaurant for chole bhature.
Yeah, but that cheat has to be one day. ये नहीं कि
Of
कि
course.
कि आज
ये तो
आज
सही
it किया, ये किया, कल मैं डोसा खाऊंगा बाहर का, परसों छोले भटूरे खाऊंगा, तरसों मैं. So virtually you are eating one thing or the other every day. No, there's one cheat day. उसमें थोड़ा बहुत जो खाना है आप खा लो.
And what about fruits and salads, mixing that in the routine, Dr. Kapoor?
Yes. So fruit, well, maybe around 200 grams a day, 200 grams, not more than that. And the other thing is that you have to give a gap of 2 hours between your major meal and the fruit. Otherwise, the sugars will surge and they'll send your HbA1c topsy-turvy.
And this is true for anyone who's even trying to prevent diabetes, correct? It's better.
Not as much, But yes, still. But for diabetic patient, it's an absolute must.
Got it. So, Dr. Kapoor, coming to our last segment before we take some questions from the audience is on technology and diabetes, right? So, you are at the helm of, endocrinology at a tertiary hospital. So, you've seen it all. How have things picked up in terms of CGMS, continuous glucose monitoring? Have you seen people adopt that?
So I will tell you something that when we did our MD, even glucometer was a rarity. We are from that era where checking sugars meant just fasting. Nothing more than that, nothing after breakfast, nothing after lunch. In fact, even as I talk, checking after dinner is a rarity.
Right.
We check at the hospital, डॉक्टर साहब 250 आ गई. हाँ भाई आ गई. आपने घर में कितनी बार चेक करी खाने के बाद? वो तो हमने करी नहीं. So how do you know कि घर पे हाई नहीं थी? Right? So CGMS, well, it is in vogue. CGMS prevents repeated pricks. Mind you, insulin injections are not painful. This is painful.
I'm sure. Yes.
Right? So yes, so you can check the sugar anytime and every time without having to prick yourself. But one thing you must understand that CGMS runs 15 minutes later than the blood sugars. So your sugars at 4 p.m. maybe would be here, reflection at 4:15 p.m.
So that's quite risky for a low sugar episode then.
Absolutely. So you have a low sugar, you check this, it's maybe 80, low 70 hoti hai, 80 hai abhi to. You may ignore it. But what happens is that this is very, very uncommon. But since you mentioned, yes, we do monitor with CGM because that's so convenient. The only issue is cost. It used to cost 5,000 for 14 days.
Yes.
That's
It's still the cost. And the accuracy is fine, Dr. Kapoor?
Barring that 15-minute delay, it's fine.
But plus minus the range is fine.
But let me tell you two things. That someone has an HbA1c of 13%. I would never use this in him. Never.
Why?
Because every time you check, the sugars are bound to be high, no?
And then
the glucotoxicity will take time to reverse. Not in 15 days. And the fellow has that. Every 5 minutes he'll do this. Sugars will high and he'll panic. Again,
stress,
the catecholamines.
cortisol. Yeah.
And sugars. So two benefits. My fasting is controlled. My PP is controlled. Still it is 7.5. I want to know where I'm going wrong. That's where it's beneficial.
Right.
Second, I want to figure out which foods actually promote diabetes.
Correct.
So for example, today I had paratha, tomorrow upma, day after poha, then
Yes.
idli, and then I see, and whatever causes sugar surge, I'll avoid that.
Yes, we've seen that some patients react to papaya, for example. It's just some people have different tendencies.
Yes.
And have you seen in some patients, Dr. Kapoor, that all sugars are mostly controlled, but certain postprandial or 2 hours after meal sugars
very common.
are isolated high.
Very common.
So that's common, and then you have to manage with some other drugs. Got it. And now what about artificial pancreas? We kept hearing about it since a decade, but we've not seen that pick up. So
No. So let's not go into that. The reason is that it's very, very uncommon in India.
okay.
And, we've already faced a lot of trouble with this diabetes reversal bit. When people, got really enthusiastic.
Yes.
15-year-old case of 15 years of diabetes, and then they want reversal. No, that doesn't happen. So
Correct.
so yes, so it's a point of raising false hopes. So yes, but pancreas transplant in India as a routine
Is not common.
is a distant possibility.
Got it. Great. So, Dr. Kapoor, I think people are extremely intrigued by all your, suggestions and kind words of wisdom. There are too many questions, but we'll take few cues from the team and ask a few. There are questions on alcohol and diabetes. So, if someone has diabetes, can they still drink alcohol, and in what capacity?
So, of course, in diabetes, first of all, nothing is a no. Let me tell you that even mangoes are allowed. But whatever is allowed, no one would consume that. I would say half a slice of mango, you would never have that. You'll have the whole mango, and that's the problem. So that is why, as a blanket, we say no. Right? So alcohol is allowed, but there are certain conditions. Number one, beer. Beer causes lots of triglycerides and weight in the belly. So I would actually discourage from the beer. Yes, you could have 60 ml of whiskey, or in ladies 45 ml. I'm not having any gender bias, but the reason is that the capacity of the lady's liver is less than that of a male, which is obvious for the small body frame that they
And
have.
that too rarely, right? You're
Yeah. So because of the small body frame. So yes.
If you must have, then,
Yeah. And if you have a fatty liver, please avoid alcohol totally.
Got it.
Totally.
Got it. The next one, Dr. Kapoor, is a random sugar of 150 unsafe in pregnant women?
Yes. Absolutely. So in women, fasting below 95. So first of all, in a diabetic person, fasting 90 to 130 and 2 hours after food less than 180. That's the diabetic person. In a woman with pregnancy, less than 95 fasting. At the end of 1 hour after food, 1 hour, less than 140. And 2 hours after food, less than 120. But 1 hour sugar is more reliable, or shall I say, more in sync with the pregnancy outcomes.
Got it.
But 150 at any point in time is bad.
Got it. The next one is, how much honey can I have in a day? I think you stressed upon honey, so now people want to know.
I didn't stress. I just said.
You allowed honey, I mean.
No, I didn't. I just said a granola bar with honey is better than that with
Okay.
sugar. I didn't allow honey. No,
Yeah.
I would never do that.
But very rare
Yes,
traces.
yes,
Got it.
yes.
Okay, the next one is on marathons and diabetes. If someone has diabetes, can they run marathons?
So diabetes type 1 and type 2. If someone has type 1 diabetes, planning to run a marathon, check the sugars. If they're more than 250 or less than 70, no, you won't run it. And in type 2 diabetes, if someone is on sulfonylurea, the drugs which may cause low sugars, you should run marathon. Even on insulin, you should run marathon. But you must have something sugary with you.
Got it.
Also, if you're taking insulin and injecting in your thigh on the day of the marathon, inject in the abdomen on the here.
Okay,
Not
so
on the
you
thigh, not on the
don't
thigh.
hurt your...
No. The absorption will be erratic, no? If it's in the
Okay,
thigh.
got it. If my sugars are normal but I still have frequent urination, why is that happening?
No, that can, there are many causes. Rest assured, you don't have diabetes. But
Got it.
that can be many causes.
And the next one, we'll take a last one, Dr. Kapoor, on apple cider vinegar. Is that safe? Have you seen that happen?
Yes, it's safe. It's safe. No, as I said again, that people take it, people report benefits, but I would not vouch for it. I'm not against it because not vouch because it's not in my system. Not against because people have said it benefits them.
Got it. Great, Dr. Kapoor. Thank you so much for sharing, those years of learnings with our audience. Any last tips you want to share with our audience today?
So, the treatment for diabetes starts before the onset of diabetes.
Wow, yes, so true.
And the treatment is
Lifestyle.
diet control, exercise.
So just a disciplined, good life is what will prevent these diseases. Great, and I hope, we all wake up to this, what you said, Dr. Kapoor, and we prevent this in our children and the young population, because as you rightly said, if the young people end up with these diseases, what happens to our country and our productivity and our innovation? So that's our biggest takeaway. Thank you so much, Dr. Kapoor,
Pleasure.
for being with us today. We had a wonderful learning session with you, and I hope our audience did as well. Yeah. And we again thank you from the bottom of our hearts for sharing all of these great learnings. Thank you,
Thank
Dr.
you so
Kapoor.
much. Bye-bye.
To our audience, we'll see you on the 19th episode of Conversations with Zyla very soon with some amazing people just like Dr. Kapoor. Until then, good night, take care, and take care of your health. Bye-bye.